Good evening, HIM 5363. My name is Lisa Smith and welcome to my Health Information Management presentation over privacy and security challenges. My presentation will discuss a brief history of the Health Insurance Portability and Accountability Act of 1996, define terms that will be discussed in the presentation, discuss challenges that we're facing as HIM professionals in an increasingly electronic healthcare system, go over risk management strategies for mitigating improper use of patient health information, and discuss the importance of consumer education. First, I'll go over some definitions, some that you're already familiar with. HIPAA is the Health Information Portability and Accountability Act of 1996. It provides data privacy and security provisions for safeguarding medical information. Privacy is the right of a patient to control disclosure of protected health information. Security is the means to control access and protect information from accidental or intentional disclosure to unauthorized persons and from unauthorized alterations, destruction, or loss. The HIPAA security rule is the federal regulation created to implement the security requirements of HIPAA. The HIPAA privacy rule is the federal regulations created to implement the privacy requirements of the simplification subtitle of HIPAA, afforded to patients certain rights to and about their protected health information. And interoperability, the capability of different information systems and software applications to communicate and exchange data. A little bit of history about HIPAA. The Health Information and Portability and Accountability Act was passed in 1996. The Health Information Technology for Economic and Clinical Health Act, the HITECH Act, was passed in February 2009. This affected how healthcare providers demonstrate compliance with the HIPAA privacy and security rules. And the American Recovery and Reinvestment Act of 2009 amended privacy and security rules to encourage the adoption of the Electronic Health Record, or EHR. The HIPAA privacy rule was passed in December 2000. The HIPAA security rule was established in April 2005. And these are all key laws for protection of patients nationwide. Also note, Subtitle F of HIPAA requires that Congress establish standards and requirements for the electronic transmission of health information and privacy and security of that information before 1999. Some of the challenges that we're facing are information collected by non-HIPAA covered entities, devices and online-based services, collection, dispersal, and sharing of health information by consumers via devices and online-based services, gaps in policies addressing accessibility, security, and privacy, and limited understanding of when data is protected and when it is not. Reports from the United States Department of Health and Human Services reflect a rising concern in the lack of clear guidance and oversight pertaining to the privacy and security of non-covered entities. With this new age, devices such as Fitbits, Apple Watches, health social medias, and mobile applications for health, there is much conflict surrounding the accessibility non-covered entities have to patient information. Because these devices did not exist when HIPAA was originally passed in 1996, regulations are outdated and there are questionable gaps concerning the accessibility, security, and privacy of patient information when accessed via one of these devices or online services. Additionally, there are rising concerns regarding an individual's understanding of when their data is protected and when it is not. Individuals who share their health information with non-covered entities may not fully understand where the protections afforded by HIPAA begin and end, and this could cause an inadvertent disclosure of sensitive information. Risk management strategies for cybersecurity, national unique patient identifier, and patient matching. When surveyed, Ponemon Institute stated that they do not have processes in place for internet and social media monitoring, citing that they are non-existent, partially deployed, or inconsistently deployed. Another alarming fact is that less than half of the surveyed organizations reported feeling like the company was adequately equipped with the tools for monitoring, analyzing, understanding, and mitigating external threats. Cybersecurity is imperative for the healthcare delivery system, as cybercriminals are becoming increasingly clever with how they obtain sensitive information. A bill created to develop a national unique identifier remains unpassed due to the banning of using funds to assist in the development. A report, however, states that this limitation does not prohibit the Health and Human Services from examining issues around patient matching. This clarification has been cited as a step forward in promoting patient safety and enabling the accuracy in identifying patients to their health information. Recognizing the importance of consumer engagement and advocating for patients' understanding of their rights is actually one of AHIMA's primary goals. Initiatives such as MyPHR.com, Share.com, and the Blue Button Initiative are just a couple of the patient-centered advocacy programs that AHIMA endorses. MyPHR.com offers information on how to access medical records, as well as information regarding why a personal health record is important and how to start a personal health record. ShareCare.com is a platform providing personalized information, programs, and resources designed to assist in the improvement of health. It uses a real age test as an assessment tool to provide information to the users based on how they respond. It also offers a clinical decision support tool called AskMD. The Blue Button Initiative enables patients to view as well as download their personal health information. This platform is supported by many stakeholders, allowing a more secure, timely, and electronically accessibility to their health information. What are the Privacy Bill of Rights? These were developed from the privacy rule, enabling patients to be informed of the privacy practices of their health information and to be informed of their rights. I'm just going to read off the Privacy Bill of Rights. Consumers have a right to view their health information or get a paper or electronic copy of it. They have a right to receive accurate and complete health information recorded by their providers. They have a right to ask for changes to the personal health information. They have a right to know how their personal health information will be used or shared and who has received it. They have a right to ask for limitations on its use and release. They expect their health information to remain private and secure. They have a right to be informed about any breaches of their health information. And they have a right to file a complaint or report a violation. HIM professionals have a big responsibility regarding patient engagement. Some of the ways in which they can help educate patients on their rights is to post Consumer Health Information Bill of Rights from AHIMA in waiting areas where they will be clearly seen. They can also ensure that any public broadcasting done by the organization includes information about patient privacy rights. Regular sessions pertaining to privacy and security topics and the implementation of a hotline available to patients to have questions about their privacy and security answered are all ways the HIM professional can participate in the consumer education of patient privacy and security rights. Thank you guys for listening in. Hope you enjoyed my presentation. Have a great Christmas break.